At a clinic set up by the organization Avegagahozo here in Kigali, women between the ages of 30 and 49 are tested for cervical cancer free of charge. When you are tested for cervical cancer, it helps with early detection if indeed you are sick, and if not, then it helps to put you at ease knowing you are healthy. I decided to come for testing, and if I am found not to have it, then great. However, if I test positive for it, then I will have caught it early. Health experts warn that women can carry the virus that causes cervical cancer for decades with no symptoms, which is why early testing is so important, preventing the virus from causing full-blown cancer. They say women with HIV and compromised immune systems are 5 times more likely to develop cervical cancer, as are females who became sexually active early in life or have many sexual partners. Once a testing sample is provided, results become available after 2 weeks. The Avega Clinic has tested 395 women since August this year. Rwanda's First Lady is calling on all people around the world to work together to fight the cancer, which kills the most women in developing countries, yet most of its forms are preventable.
Up to 93% of cervical cancers are preventable, but today cervical cancer is the second largest killer of women in low and middle income countries after breast cancer. And this is unacceptable when taking into account the available technology, policies and cost-effective measures for early diagnosis and treatment. The HPV vaccine Gardasil 9 has proven to be highly effective if administered before a girl or woman is exposed to the virus. In Rwanda, the HPV vaccine was introduced in 2011, pushing us to initiate a countrywide strategy to fully implement WHO recommended program to screen, treat and vaccinate targeted population groups.
Her Excellency Jeanette Kagame is especially urging men to play their part in fighting the cancer.
Although HPV is the most common viral infection transmitted through sexual intercourse, HPV-related cancers are not common in men, as it is in women who are more likely to develop cervical cancer. But to this day, there is limited knowledge of HPV among men, which comes with the risk of undermining the progress made so far. Hence, male partners must be actively involved in the cervical cancer prevention process by increasing their awareness about the disease and its transmission, protecting their partners from HPV infections.
Though Rwanda is pushing to eliminate the cancer, testing figures are still quite low in the country. The UN, in its new push to eliminate cervical cancer, says we should be at a testing rate of at least 70%, but we are currently at just 10%. So you understand that we still have a long way to go. As part of the initiative, we should be able to treat at least 90% of those tested. It is encouraging, therefore, that we have the capacity to treat them even at health centers. When treatment is done early, a person can fully recover and continue with their lives. The Rwanda Biomedical Center says that in 2018, 357 fresh cases of cervical cancer were identified among women in the country. A total of 124,000 women have cervical cancer, or 24 in 100,000. 15,000 women have been tested for signs of the cancer before it fully develops using the HPV DNA method. Since 2016, more than 250,000 women have been tested. Testing among teenagers is at 97%, with the UN recommending at least a 90% testing rate among them. Over the next 5 years, up to $38 million is to be spent fighting different forms of cancer, a quarter going towards fighting cervical cancer. The World Health Organization warns that Rwanda could see 1,200 new cases every year, basing on the country's population. It costs 20,000 Rwandan francs to take the test. This is the first time the world has united in fighting cervical cancer, following a plea from the head of the World Health Organization back in 2018. The organization says if countries implement what they have pledged to do, new cervical cancer cases could be slashed by as much as 40%, and 5 million women could be saved before the year 2050, with 300,000 deaths recorded because of the cancer every year.